Hello, my name is Edna Navarro Vidaurre. My pronouns are she, her, ella, and I am the Regional Council Manager for Birth to 5 Illinois, Region 1A covering City of Chicago, Cook County. At this time, I'd also like to introduce today's co-presenter.
Hi, my name is Mikeela Collins. My pronouns are she and her, and I am a family council leader.
Thank you for watching Region 1A's Early Childhood Regional Needs Assessment Virtual Report. This recorded session will provide an overview of findings from the Birth to 5 Illinois Region 1A Needs Assessment, as well as talk about the strengths, needs, and recommendations for improving access to and enrollment in early childhood education and care programs in the region. A link to the full report can be found in the description below. If you would like to turn on closed captioning, click the CC icon at the bottom of the video. This will turn on the captions. If you want a language different than English, click on the gear icon for settings, click on subtitles, then auto translate, and you can scroll down to pick the language you want. A Spanish version of this webinar recording and slide deck is also available on our region's website. Some Birth to 5 Illinois regions partnered with existing collaborations to complete the regional needs assessment. Region 1A partnered with Every Child Ready Chicago, also known as ECRC, which is a public-private partnership led by the Mayor's Office in partnership with Start Early, formerly known as the Ounce of Prevention Fund, working to ensure all children in Chicago enter kindergarten ready to succeed in school and life. The multi-year collective effort works to align the prenatal to 5 systems and supports serving Chicago's children and families under a unified vision and to build the early childhood education and care ECEC infrastructure needed for thousands more children to enter kindergarten ready to learn. ECRC is made up of several committees, including Access and Enrollment, which is led by Birth to 5 Illinois Region 1A. We thank them for their partnership and continued support as we work together to improve outcomes for children and families throughout our region. In 2021, the Illinois Commission on Equitable Early Childhood Education and Care Funding issued a report with findings that highlighted the inequities in early childhood funding in Illinois and the need to create a better statewide infrastructure to support early childhood professionals, expand services and programs for families and caregivers, and increase enrollment in ECEC programs. The report focused on the importance of addressing racial inequities and the need to include local voices in the conversation funders and decision makers were having about early childhood education and care. To provide a structure for communities, families, and caregivers to engage with the data and share their experiences, a new statewide infrastructure was created across 39 regions, all of which align with existing Illinois State Board of Education regional offices of education boundaries, but operate independently. Birth to 5 Illinois regional boundaries align with school districts instead of strictly following county lines, which can be a challenge for gathering and interpreting data because many early childhood services are provided by or tied to school districts. Region 1A is situated in Cook County and represents communities woven throughout and governed by the city of Chicago. It has 77 communities spanning southeast to the Indiana border, east to Lake Michigan, north to the Cook North boundary, northwest to O'Hare Airport, and west to the Cook West boundary. Joining me in the Region 1A office is Jacqueline Ledesma, our Family and Community Engagement Specialist, and our Administrative Support, Socorro Hinojosa. The experiences and knowledge families, caregivers, and early childhood professionals gain while navigating the complexities of the state's early childhood education and care system are valuable, and understanding their lived experience in the local context is vital for decision makers to ensure communities have access to the programs, services, and supports they need. To this end, Birth to 5 Illinois was created to harness family and caregiver voices in early childhood education and care and serve as a bridge between the communities and policymakers so family, caregiver, and professional experiences can guide the decisions made to expand or enhance services across the state. Our mission is to create a statewide regional infrastructure that will amplify input from communities in the development of policies and funding priorities. We support the mobilization of communities to build and sustain equitable access to inclusive, high quality early childhood services for all children and families in the state of Illinois. We envision that our work will help all stakeholders reimagine a more equitable early childhood education and care system that respects family and community voice and works to ensure it is centered and prioritized at every level of decision making in Illinois. We have three main values and goals. First, we must prioritize family voice. Through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. Second, we must address the racial inequities that exist in our early childhood system. In an effort to move our early childhood education and care system to one where racism no longer impacts a child's success, we will work to dismantle barriers that have limited access to high quality services for minoritized children in every corner of our state. Third, we will use the collective impact model to shift the current early childhood system to influence policy and funding at the local, regional, and state level. Birth to 5 Illinois will use community-driven feedback to build a system that harnesses knowledge directly from families and providers and encourages decision makers to ensure new and/or expanded services are created to meet community needs. Two critical parts of the new statewide infrastructure are family councils and action councils. Located in each of the 39 regions, the councils provide feedback on quantitative data from the Illinois Early Childhood Asset Map, or ICAM, and the Illinois Network of Childcare Resource and Referral Agencies, or INCRA, to help contextualize the data at the local level. The councils meet twice a month in virtual, in-person, or hybrid meetings. The family councils are comprised of parents, caregivers from a wide variety of family types: single parents, adoptive and foster parents, caregivers of relatives, teen parents, two-parent families, multi-generational families, and more, and prioritize the voices of those who have not been involved in this type of work before. We want to highlight those who have been involved in our Region 1A Family Council over the past year and thank them for sharing their experiences with the early childhood system. Yesenia Billones, Michaela Collins, Cecilia Gutierrez, Marshanae Mack, Karina Mendoza, Jericho Amor, Delia Perez, Lisa Radcliffe, Alicia Rivera, Edith Rivera, Marisela Salazar, and Linda Wang. Action councils are comprised of early childhood education and care professionals, healthcare providers, faith-based leaders, elected officials, and other community members. Each action council reserved 2 seats for parents, caregivers to ensure family voices were included in every discussion. Action council members were invited to bring additional aggregated data on programs and services provided by their agency organization to complement data from ICAM and INCRA. We extend thanks and gratitude to our Region 1A Action Council members: Carrie Byers, Sorethel Burgess Burnett, Bria Carter, Carrie Comer Yates, Kate Connor, Alana Friedman, Leslie McKinley, Felipa Mena, Candace Moore, Tommy Robinson, Bridget Runquist, and Markinta Thomas. Beyond the council meetings, additional qualitative data was collected community-wide through focus groups and interviews, and all council members were invited to provide input on each section of their early childhood regional needs assessment. Over 20 focus groups and interviews across the region, Council members develop the strengths, needs, and recommended next steps that are unique to each region. Regional teams, along with the support of their Action and Family Council members, created a dissemination plan and are holding community meetings virtually and in person to share their report's findings. The following slides highlight some data that was discussed by council members and provide insights into the early childhood education and care landscape in our region. Region 1A is the fourth largest city in the country and is rich in diversity across race, ethnicity, socioeconomic status, abilities, and geographies. According to the 2020 census, Chicago's total population was 2,746,388, with 193,623 children under and including age 5. There are 101,136 children birth to age 2 and 92,487 children age 3, up to and including age 5. According to the 2020 census, there are 165,844 children ages birth to age 5 before their 6th birthday, from a multitude of racial and ethnic backgrounds. Below are a few. 56,297 Latino, Latinx, Latine, Hispanic children, 50,162 Black or African American children, 43,347 white or Caucasian children. While data on children and families from priority populations is limited, there are a few things to know about Region 1A. 87,722 children ages 0 to 5 are at 200% federal poverty level. There are 48,082 households in Chicago that speak Spanish, 38,948 households that speak a language other than English. Region 1A has many families that are identified as priority populations. Council members prioritize elevating the following priority populations: families experiencing barriers due to language, families experiencing poverty, families with children with disabilities or diverse learners, families who are unhoused, and families experiencing the child welfare system. Community collaborations are an integral part of the early childhood landscape. Local early childhood community collaborations bring together community agencies, organizations, and individuals with a shared vision or goal. They understand the importance of improving early childhood education and care for children, caregivers, and providers. Region 1A has 10 community collaborations. These community collaborations have been engaging families and community stakeholders for varying lengths of time. They include the following: Altgeld Riverdale Coalition, Chicago Head Start Collaborative, Chicago West, All Our Kids A-OK Network, Chicago Southeast, All Our Kids A-OK Network, Connect Teen, Little Village Education Collaborative, Bridging the Gap Communal Living Englewood, Margaret F. Lee Violence Prevention Intervention Collaboration, North Lawndale Early Learning Coalition, the Jewish Early Childhood Collaborative, Southside Early Learning Network. Early childhood community collaborations are critical and known as boots on the ground, helping families navigate Chicago and Illinois' complicated systems. Collaboration staff are trusted community leaders that help to translate policy to families' realities and connect families to supports. More information on the local collaborations and the work they are doing can be found in the Regional Needs Assessment. The City of Chicago has a very robust offering of ECEC programs available to serve families in a variety of settings such as homes, centers, and schools. ECEC programs can be divided into two main categories: publicly funded programs and childcare programs. Although Chicago's ECEC landscape offers many programs in different settings, a variety of factors such as multiple funding streams, program eligibility requirements, and lack of awareness make it complicated for families to navigate. Families stated that there is minimal transparency of where they can easily access special education, bilingual, dual language supports, as well as a lack of program capacity for children ages 0 to 3, such as home visiting and center-based childcare. Overall, there are not enough slots in both childcare and publicly funded programs to serve Chicago's 0 to 5 population. Stakeholders reported needing improved slot gap data to understand where children are being served, which can lead to intentional advocacy efforts to request funding and policies to meet local needs. Below is a quote that captures families' experiences with the ECEC system. Because programs rely on multiple funding streams, families must meet the various eligibility requirements, which may become a barrier if they do not know if they qualify for them, or they may ask for a lot of paperwork, so families get discouraged to participate. Region 1A celebrates the variety of local ECEC workforce initiatives and its stakeholders that have been and continue to actively work towards addressing Chicago's ECEC workforce and the challenges they experience. According to the 2020 snapshot, Workforce Behind the Workforce publication, Chicago's ECEC workforce in general is more highly trained than in other parts of the state, which could be due to the blending and braiding of resources. ECEC providers report that there is high staff turnover due to low compensation and lack of available training to support children entering the system with increased behavioral and mental health needs. The ECEC workforce landscape has already changed in the last few years due to a variety of factors, but the pandemic really exacerbated the crisis. Workforce leaders report that they do not have full picture of the current ECEC workforce. For more information on ECEC workforce recommendations for future consideration, please see the Bellwether Education Partners Report from 2019. The quote below is from a workforce stakeholder. Compensation is often skewed based on race. Make compensation and education equal for all in the field to attract more applicants to provide high quality education.
Family and providers' perspective regarding who is not accessing Chicago's ECEC system and why. The word access can mean different things depending on families' lived experiences engaging with or navigating Chicago's ECEC system. The largest barrier reported was the lack of awareness of ECEC program availability and qualifications. Families shared many examples of limited access to technology, which is where many public programs advertise, documentation requirements, and not having in person support to navigate the enrollment process. ECEC programs, due to staff shortages, several shared that programs have the physical classrooms and children on a waiting list, but no qualified staff to open the classroom. Families also face barriers due to the lack of publicly funded slots that adequately meet their financial situations and non traditional work schedules, especially for their children from birth to age 3. ECEC program leaders have heard from families that if they have a child with special needs, are unhoused, or their legal status falls under undocumented, they experience even more barriers than other families in the region. The quote below captures families and caregivers' experiences with program enrollment. When I signed up for the program, it was almost like a secret I found out about, especially as it had to deal with income and program availability. Some programs are free, but in other programs, people must pay. They're not aware of all the requirements. Community and council members identified several strengths of the early childhood system in the region. For the sake of time, I will only share a few. The greatest strength in the region is strong community support. The city of Chicago and the willingness of community members to come together to share resources and insight to meet the early childhood education and care needs of children and families. Various public data sources, number of publicly funded ECEC, many existing workforce initiatives, and collaborations. Community and council members also identified challenges and opportunities for growth in the region as well. For the sake of time, I will only share a few. Needs: improvement, public data facing systems, streamline the complex and confusing ECEC system, increase number of ECEC programs to serve all children, especially those in the birth to age 3 group. Need to better resource local collaborations, address workforce issues because programs may have program slots, but not the staff to fill the classrooms. Based on community and council conversations, recommendations have been made on how early childhood education and care program services can be improved for families in the region. Recommendations will be presented to lawmakers, state agencies, local elected officials, and founders so they can better understand the needs of families in the region and share the recommendations with them so they can see how to best meet those needs. These are a few of the recommendations made, but more can be found in the regional needs assessments. Recommendation 1: improve public facing data system. Recommendation 2: build upon the Chicago Early Learning System by streamlining ECEC offerings. Recommendation 3: create sustainable funding plan that leads to an action plan focused on increasing 0 to 3 programming, increasing staff compensation, and ECEC collaborations.
This summer, we will be out in the community talking to more families, providers, and stakeholders about their experiences with early childhood education and care, and we want to talk with you. We invite community members, families, and early childhood professionals to join the conversation by filling out a council interest form. Please go to www.birth5illinois.com/councils/region or click on the link in the description to get involved. Interest forms will close later this summer, with council meetings fully resuming in August. I want to thank our state partners for their support and you for watching. We encourage you to stay in touch with us by visiting our regional page at www.birth5illinois.com/region1A, joining our Facebook group, or reaching out to me via email at enavarrovidale@birth5illinois.com. Links to our pages, along with my email address, are available in the description below. Thank you for your time. We look forward to connecting with you soon.